cognitively. Doesn't the slide look and sound a whole lot better? The previous slide demonstrates what FASD diagnosed individuals experience daily when exposed to bright lights and loud noises. Colors and sounds that may look and sound normal to us actually appear excessive and outrageous to FASD diagnosed children. The effect that light and color have on them is only a minor inconvenience compared to the other implications that FASD causes them to have. Some major ways FASD affects children is by creating problems in home and school environments and by causing them to have physical deformities.
One important aspect of fetal alcohol spectrum disorders is home life, as homes and families are the first identifying party of the symptoms of FASD, and therefore gaps in the diagnoses are extremely important to address. In biological homes, 27.3% of all individuals with FASD experience difficulties with the law and suicidal ideation. In the child welfare system, children experience much greater difficulties with the law because 80% of all children within the system have FASD, but 90% of administrators and parents have never dealt with the symptoms and are unprepared to combat the behavioral difficulties. This ignorance within the system leads to 24.1% of all children in the child welfare system with FASD experiencing behavioral misconduct at the legal level. Both home life scenarios are extremely dangerous when FASD is not afforded the support it desperately requires.
The next area where children with FASD tend to struggle is in school environments. Academic environments can be very difficult for children with FASD due to the cognitive issues that accompany their disorder. According to Krista Davis, an FASD researcher, some of the cognitive issues that accompany FASD include problems with basic mathematics, problems with grammar and semantic abilities, as well as issues just with basic memory. The lack of these basic cognitive abilities can make core classes very difficult and can make it almost impossible for improvement academically. There are also many behavioral issues that accompany FASD. According to Ace Fagerlund, a psychotherapist, some of the behavioral aspects of FASD include problems paying attention during class, issues with social interaction with parents, students, and teachers, and just having difficulties expressing how they're feeling through words.
And finally, the last major problem that FASD causes children to have is physical deformities. These deformities can range anywhere from being small yet identifiable facial feature changes to more drastic and major changes that can affect their ability to function. Some of these major changes include loss of hearing and speech impairments. 80% of children diagnosed with FASD experience hearing loss and increased difficulties paying attention. Hearing loss can make interacting in social environments, especially school for young children, hard due to not being able to hear their teachers and peers as well as the other students can, which can be very frustrating. 90% of FASD diagnosed children also experience speech impairments as well, which also affects their ability to communicate in society. This makes communicating hard due to not being able to express their emotions quickly and correctly, which is also another frustrating element. Both of these being factors that affect their ability to communicate and interact in society.
Due to the seriousness of each aspect of the problem, we are left with the question, what are the best solutions for the complications of fetal alcohol spectrum disorders?
The three main aspects of our solution are to identify and start treatment for FASD during the prenatal stage, postnatal stage, and early to mid-childhood.
Early diagnosis of FASD requires honesty from irresponsible adults and a thorough assessment of the mother's and baby's health, which ultimately are both factors that make diagnosing FASD in the child before birth very difficult. A study was done by neuroscientist Lindsay Avalos, among other scientists, to determine whether women who do not take multinutrient supplements are more prone to the effects of alcohol consumption during early pregnancy compared to women who do take multinutrient supplements. Data was recorded and it was found that women who do take multinutrient supplements were not as much at risk for risk of preterm delivery in babies born smaller than the 10th percentile compared to women who do not take multinutrient supplements. This giving evidence that supplemental use is one efficient way to combat the effects of FASD before the baby is even born. However, there are some limitations to this solution. In order to provide the necessary supplements, the mother has to come forward to her doctor and explain that she has been consuming alcohol throughout the course of her pregnancy, which the majority of the time, this just does not happen. Often as well, women who do drink alcohol during their pregnancy do not regularly visit a doctor or have access to these supplements because these supplements are very expensive, which adds to the limitations of this solution. There is no no cure for FASD, especially at the fetal stage, where it's nearly impossible to predict the level of severity of FASD in the child before it's born, which is why this solution is not the most ideal.
Although treatment before birth is innovative and new, not all women have access to prenatal care. However, most women do have access to postnatal care, as they give birth in the hospital and are receiving care shortly after delivery. According to Nathan J. Murawski, professor of neurobiology at Butte College, children with FASD do not consume correct amounts of omega-3 fatty acids, vitamin D, and choline, which are all three essential nutrients for neurological and behavioral development. In a controlled experiment done on rodents afflicted with FASD, administering these micronutrients shortly after birth significantly mitigated the ethanol-induced impairments on brain and behavior. Essentially, during pregnancy, being exposed to alcohol blocks the correct amounts of these three essential nutrients from getting to the body and successfully developing the brain and behavioral aspects. But if the children are given these supplements shortly after birth, the symptoms of FASD caused by not receiving these supplements can be reduced significantly, if not reversed entirely. However, there are some limitations to this solution, including access and cost, as some women in extremely poor situations may not even have access to postnatal care. And even women who do have access to postnatal care may not be able to afford the long-term cost of the nutrient supplements, as children may need them for months after their birth to years after their birth. So some sort of insurance copay or external financial support would be needed to make this an economically viable solution.
If the symptoms of FASD are not identified until early to mid-childhood, hope is not completely lost. Children of 3 to 6 years of age can still experience forms of intervention to help reverse the symptoms of FASD. Behavioral and educational therapies are some forms of therapy that children with FASD can endure to reduce their symptoms. According to the CDC, there are many forms of academic as well as behavioral therapies that can help these children. One of these therapies is known as Good Buddies, a 12-week session in which children with FASD continue to have playdates with other children and peers as a way to work on social interactions through a process known as osmosis. There's also the Mathematical Intervention Learning Experience, or MILE, in which children attend a 6-week program of one-on-one tutoring in which they work on basic mathematical cognitive skills, as well as just learning how to be motivated to do homework and to just be in class. However, there are some limitations to this amazing solution. Improvement is not guaranteed for children with FASD, and it is not known to what effect the symptoms of FASD will be reduced, if reduced at all. Also, a child with FASD must put in 110%, or else they may not get anything out of their therapy.
Because of the limitations in each proposed solution, the most economically effective treatment for FASD in children is postnatal intervention. Both prenatal and late childhood interventions are untested and economically followable. Postnatal intervention is the most widespread solution, and with certain economic help, financial help can be available to most women who need the help.
Okay, ladies. All right. Alex, what is an example of a compelling argument from one of your peers' individual reports that you decided to exclude from your team presentation, and why?
One thing that we decided to exclude from our team presentation was some of Ella's things about physical deformities. One of the things about physical deformities is that some of the speech impairments actually come from problems with the tongue, but because of a lack of time, we decided to take that out and just talk about speech impairments in general.
Okay, very good. Okay, Ella, describe how the content of the team presentation was changed as a result of group discussion.
As a result of group discussion, we originally had prenatal care as our most effective solution, but then talking about that, we realized that it's pretty impossible to diagnose it before the baby is born, and so we changed our ideas to postnatal intervention, where it's a little bit easier to diagnose it in the child.
And Ashby, how did the group decide to include Alex's perspective, lens, or conclusions in the overall presentation?
So most of Alex's perspective and lens was on the behavioral aspects, especially in school environments. So we recognized that that was an essential part and needed to be a part of our solution. And so using postnatal intervention and supplements, it helped combat any neurological or behavioral problems shortly after birth. So the child was able to develop normally throughout their childhood. And so combating the behavioral aspects helps to prevent any difficulties in school environments, which is mostly what Alex researched.
Okay, thank you, ladies.